I'm out here supporting the workers, the healthcare workers at St. Joe's Hospital. One, because these are the people who take care of our community. They work hard, they take care of our sick, they take care of our elderly, the women who are having babies, and it's time for us as a community to take care of them. The employers here at St. Joe's Hospital and CHI Franciscan, they need to hear their voices, but more than that, they need to know that these are the people who make our community safe and healthy. It's all about patient care. I had an aunt who was here just last week who was here for over a week, and it took 5 days before she could get a bath because of how short-staffed they were. That's not okay. Not only that, but they were getting messed up medicine because they were just so overwhelmed with the amount of patients. Management just proposed a proposal that said that one CNA would have to deal with about 18 patients at once. That is inhumane for one person to have to deal with 18 different people. There's no way that they can meet the needs of the patients. So we're out here to support and stand in solidarity with the healthcare workers here at St. Joe's Hospital.
I'm here today because there are moral issues going on. There are professional people who work here, staff, who are compassionate people. Their mission in life is to heal, and some of them, many of them, are available for social services. They can't live on their own incomes. There are staff here who are living in their cars. There have been shootings in this building that most of us never heard about. These are unacceptable conditions for people who are just trying to heal. And as clergy, we're also out here on behalf of our members. Some churches have had members where folks had to wait a week to get a bath, or their medications were messed up, or dosages were incorrect, or they had to wait too long to get them. Health is it should be a human right. It's not about profit. We really need to stand up with these folks at SEIU 1199 Northwest and help build a better hospital.
I'm Pastor Young of the Shiloh Baptist Church, and I'm here supporting the SEIU as they are fighting for better wages, fighting for being understaffed. Even I, as a shepherd of Shiloh Baptist Church, have visited members and them not getting the full care that they need because of understaffing. And so we fight with the nurses and the doctors and all of the staff here at St. Joe's Hospital for better pay, for better staffing, and making sure that each patient has a good experience while they're here at the hospital.
As a person of faith, it doesn't matter if you're a person of faith, but you care about your neighbors and people who work in Tacoma at St. Joe's, and certainly I've been a patient there myself, and I found that the staff did seem to be stretched. It was hard for me to get services sometimes, and the bath even. So I know that these are good people trying to do a good job for us who use this hospital, and it's important that we support them when they say there are safety issues, there are salary issues, that they need to lead a decent life and provide quality service for those of us who need them.
This is Bishop Dr. Lawrence White, President of the Tacoma Ministerial Alliance. We're here with SEIU, the staff and the workers of St. Joe's Hospital on the corner of 19th and I Street. We're here today to represent the leadership and the membership of the TMA who have agreed and will continue to agree with the issues and the concerns that the workers have, whether it's working conditions, whether it's inappropriate pay for the work that they're doing, whether it's patient safety. It can be better, and we must do better. But we're going to have to stand with them and holding the leadership of St. Joe's Franciscans accountable for what's right. Again, lives are at stake. Families that represent the lives that are at stake. Our community is at stake. So again, we thank SEIU for the opportunity to stand with you, and we want you to know this is only the beginning.
Okay, so I'm
I'm here to support SEIU 1199 Northwest healthcare workers. I'm here to stand with them for living wage jobs, good benefits, and the essentials that they need to be able to move up in their profession. The mega corporations have robbed them for a long time. I read where the five richest men in the world made during the time of COVID, at the peak of COVID, that they made over $4 or $5 billion or more, and ordinary people, they suffered financially during the COVID pandemic, and so they said that they didn't have no money, but yet they made all that money, you know. And I remember going through one of the hospitals, and the hospital wouldn't even buy a COVID mask. And so they had the workers had to put their name on masks so that they could have one when they go into the room with the patients. So I'm here to say that's wrong. That's not even moral, you know, and that's not saying that they care about their staff. That's saying that they don't care about their patients, and that the bottom line is always the money. And they are making money, but they're not spending money in our community. And one other thing, they slashed charity care, you know, and so, you know, we got to make a stand. We got to make an aggressive stand with healthcare workers and grocery workers. And so we got to make a stand with them. And we are the people. It's more of us than it is them. Without us, they can't make that kind of money. So I'm here to make a stand.